morning.
Forgive me, I've had 20 years of the NHS being told to change. Am I right to be a little bit dispossessed by that?
Well, the NHS has been changing over the years, and we've managed to deliver high life expectancy, improve cancer survival, and improve waiting time. So there has been change. But what's happening is the needs of the public, particularly around long-term conditions, frail older people, growing numbers of people, is just changing faster than we've been able to change. And right now, one of the critical areas is the social care and health care working together. We need to be changing that faster.
You see, I'm afraid it's too vague for me. Can you be specific?
Well, what we know is that in some instances, we're not able to provide the right social care or community care for frail older people at home, which means they end up being looked after in hospital for a medical condition that a GP could manage at home. So people are spending the wrong time in the wrong places because we haven't got the right services in place.
But isn't that about
coordination is the thing?
Sorry, I didn't mean to interrupt you. But isn't that the role of local people running the NHS and social services to solve, rather than another public attack, if you like, on the NHS?
Well, that's exactly the point that we're making. It's the leaders in healthcare and social care working together with the public who are best positioned to work out what changes are needed locally. And what we need is support from the government in having the right sort of conversation at a national level that supports that work locally.
So you don't want more money, you want better organisation?
Well, I'm sure we always want more money.
No, but you're not asking for more money.
Well, it's the politicians determine how much money there is. What we're saying is you've got to look at the healthcare spend and the social care spend together, because they are so interdependent in people's lives.
I can see that. So who does that, Dr. Marshall?
Well, currently there's a part of the government that looks at the spending in the NHS, and there's a part of government that looks at allocations to local authorities, and then local authorities work out how much they're spending on social care. You've got to look at that in the round to get the very best value for people. I
realise that, but do you want another Quango? Would you like to be director of that as well?
No, we don't want any quangos at all, Simon. What we want is people at a local level. There are something called health and wellbeing boards that bring together the local leaders in the council and local authority and social care, along with the local leaders in healthcare. We want them to be backed to deliver the changes with support from the politicians nationally.
Now, again, Dr. Marshall, you're going to have to forgive me, but bear in mind I'm a simple civilian. How would that work, ideally?
Well, ideally, I think what we want is the politicians saying, we recognise that things are really tough. The NHS has done a great job in the last 5 years in reducing or saving £19 billion, but still improving services. And the next phase is going to be even more difficult and tough. And we want the politicians to be supporting NHS managers, clinicians, working together with the public to deliver that locally. And getting that balance right. When should the politicians say something and do something nationally? When should they back us locally? We want to get that right.
Again, it's a little vague, and forgive me for coming back to it, but do you want a nurse at Derriford Hospital to talk to someone in Plymouth Council? Do you want a meeting of minds? Is that how it would work?
I don't think we want too many meetings, but meeting of minds, absolutely. We want people to be aligned around delivering improved care to people. That's
what does that mean?
Patients are priority. Well, what that means is we know from experience across the world that if it's the frontline clinicians that are able to make decisions about improving care locally, it gets better faster. And that means we need to be able to plan for the right workforce. You talked about Rob Webster talking about us needing the right workforce, not dictating how many numbers we need at a national level, but understanding what that translates into a local level to get the services right for local people.
So more power for the regions?
More power for people working at a local level to deliver better services. But
isn't that more power for the regions?
Absolutely. Well, they have the power already to a large extent. It's about making sure we're having the same discussions, that it's allowing those local people to make the decisions.
All right. Thank you very much indeed. Dr. Johnny Marshall, who's Director